Good morning. In our presentation, we will discuss the dermatoscopic patterns of cutaneous metastasis. Cutaneous metastasis is a rare clinical entity with an incidence of less than 10% among oncology patients. Cutaneous metastasis has various clinical presentations. Diagnosis can be difficult as cutaneous metastasis can mimic other dermatologic diseases. While dermoscopy is useful for many skin lesions, few data exist regarding dermoscopic findings in cutaneous metastasis. We present a dermoscopic analysis of metastatic lesions in 7 patients. These tables summarize a study conducted on 7 patients, consisting of 4 men and 3 women. The study focused on the analysis of metastatic lesions from different primary tumors. This table summarizes the characteristics of the tumor's metastasis, the size of metastasis, the delay between primary and secondary tumors, the number of metastases, and the elementary lesion of metastasis. On dermoscopy, we analyzed 15 metastatic lesions. All pigmented lesions were melanoma metastases. 19 of non-pigmented lesions were metastases from other primary tumors, while 10% were melanoma metastases. Dermoscopy shows unpigmented lesions, a brown streak, blue-white veil, shiny white streak, peppering granulati, some scales, and no discrete vessel noted. Non-pigmented metastases demonstrate a vascular pattern in 100%, with 43 of polymorphous vascularization. The most frequent subtype of vascular pattern was serpentine or linear irregular vessels. Dermoscopy find in pink lesions, shiny white lines, arborizing vessels, serpentine vessels, blue-gray granule structures. Another dermoscopy shows serpentine vessel, arborizing vessel, white structural pattern, bluish background. Pink melanoma metastasis shows a vascular pattern with serpentine vessels, hairpin vessel, arborizing vessel, shiny white lines, and ulcerations. Another pink melanoma metastasis shows serpentine vessel, hairpin vessel, arborizing vessel, a rainbow pattern, shiny white lines. International Dermoscopy Society made a retrospective, multi-center, descriptive, cross-sectional study of biopsy-proven cutaneous metastasis to evaluate the general characteristic and dermoscopic features of cutaneous metastasis from different primary tumors. They include 583 cases and 632 metastatic lesions. On dermoscopy, pigmented melanoma metastases were frequently structureless blue. Structureless brown and structureless white patterns were also common, while amelanotic metastasis shows linear serpentine vessel and a white structureless pattern. Karen Chernov et al. Find in 20 patients with biopsy-proven cutaneous metastasis, 17 lesions were pink and 3 were pigmented. All the 17 non-pigmented lesions demonstrated a vascular pattern on dermoscopy, with 15 having serpentine vessel and 2 arborizing vessel. All the pink lesions shows more than 1 pattern of vessel on dermoscopy. In the 3 pigmented lesions, dermoscopy evaluation find brown streak and blue-gray globules, an overlying bluish hue. Rosalia Alfro et al. Find in 3 patients with biopsy-proven cutaneous metastasis, 2 lesions were pink and 1 lesion was pigmented. The 2 non-pigmented lesions demonstrate a vascular pattern with serpentine vessel, arborizing and polymorphic vessel. The non-pigmented lesions shows brown dots and globule with white areas. In our case series, the dermoscopic features of cutaneous metastasis from various primary neoplasms noted a high prevalence of vascularity on dermoscopy. The 2 pigmented lesions shows a melanotic pattern with a bluish hue and peppering granulati without discrete vessel noted. The most common individual vascular pattern noted was composed of serpentine vessel. A mixed pattern of vascularity was frequently seen, falling into the polymorphous atypical category. On perspective, Moroccan multi-center study on cutaneous metastasis with a large sample size, highlighting dermoscopic features that can help in the early detection and diagnosis of metastatic disease, potentially improving patient outcomes. High-quality dermoscopic image and description can serve as a reference point for other clinicians on controlling similar cases. As a conclusion, the high prevalence of vascular structures among cutaneous metastases may suggest a role of angiogenesis in their pathognosis. These findings support the use of dermoscopic in the evaluation of suspected skin metastases or in the assessment of lesions of unknown origin in patients with cancer.